Hi, I'm making this very quick video to show you just in case if Brooke's G-tube falls out. As in the instructions, these are the items that you're going to need if it does fall out. So just make sure to wash your hands, and then this is what it will look like if it does fall out, except for it could be deflated. This is what it looks like when it's inflated. This is what helps keep it below the skin area, is a small balloon here. So I'm not sure if it were to fall out what it would look like. It could still be fully inflated like this, or it could be deflated, which I'll show you in a second. But just make sure to have this IV drain sponge. This is the lubricant, tape, and then this is the syringe. This one looks ever so slightly different, but it is a 5 milliliter syringe. It has to have this type of tip, so this is the one you'll want to use. All this is going to be found in her emergency kit that's right here. Just ignore the S, that's not related. So in case if it does fall out, depending on if it's not inflated, well, if it's not inflated, then you can go ahead and, as long as the button is clean, this would be the button, as long as this is clean, you can go ahead and let's say it were deflated, then you could just put the lubricant on it and then stick it directly into her belly. And then, as in the notes, you would just cover it with this IV drain sponge and then tape it there just so that it all stays together. And then I will be able to come in and properly put it back into place. So if the button falls out and it is still full like this, you will not be able to put this back into her belly again. So you're going to have to take this syringe, and it won't have anything in it, and then you're going to attach it to this little port here and turn it barely, so slightly, and it should fill itself. If not, then just give it a pull back to fill. It should be about 2.5 milliliters of water. Well, the main thing is just making sure this is as flat as you can get it. Even right now, it kind of has some water in it, so you just want to totally get it entirely flat. And then this is what you would put this lubrication on around this, and then you would put it just straight into the hole that's there in the belly. And then I'm sure you'll be removing this, but just to remove it would go to the left there. And then you would just cover it with the sponge here and the tape, and then it can just sit there like that until I get there to be able to do it. Just in case if it's not going in, you're meeting too much resistance, there is this blue piece that's going to be in the kit, and it does help make it go in straight and stabilize it. And you would just open up this port here and then stick it in. And again, this would be deflated and it would have lubrication on, and this just would help it kind of stay straight into the hole for you. But then remove it before you tape it back up. And hopefully that should be it, and just give me a call immediately if anything were to happen. Okay, thank you.